Good evening, everybody. Welcome to our third webinar series on COVID-19. My name is Dr. Candy Buencamino Francisco. I'm the president of the Philippine Medical Association of New England. Just a few announcements before we start. This webinar is being recorded, and if you have any questions, please type them on the chat function, and we will try to answer your questions at the end of the presentation. So it's been 5 months since we heard about the first case of COVID-19 in China. To this date, the situation remains fluid, and there is new information about COVID-19 every single day. Since our first webinar 3 weeks ago, there have been a few changes and new reports regarding COVID-19. Today, we are proud to feature 3 Filipino specialists from different states who will give us updates on the COVID-19 pandemic. Without further ado, I would like to introduce to you our moderator for today, Dr. Richmond Ramirez. Dr. Ramirez is a family physician in West Warwick, Rhode Island, and he is currently our Public Relations Officer of the PMA New England. Please welcome Dr. Richmond Ramirez.
Hello, Richmond. We cannot hear you.
You're on mute.
I apologize for that. Again, thank you for that introduction. Hello and good evening to everyone. I would like to thank everyone in our audience who elected to spend an hour of their time to listen to our third installation of this webinar series. We are doing this for our community because we're still in a fight, and the best tool to arm us right now is information. That's our objective for this series are the following. So number 1 is to provide updates on COVID-19 statistics, epidemiology, and testing, to review the characteristics and demographics of COVID-19 patients admitted in the ICU, to discuss the management of COVID-19 in the hospital setting since we covered primary care issues in our first webinar, to explore COVID-19 vaccine and treatment under investigation. 5th is to discuss the prevalence and presentation of COVID-19 in children and adolescents, especially on pediatric multisystem inflammatory syndrome, since everything is rapidly changing, even the disease name has been changed to multisystem inflammatory syndrome in children. Hence, I would like to introduce you to our panelists today. Our first one is Dr. Ryan Chua. Dr. Chua is a triple board certified in internal medicine, pulmonary and critical care medicine. He received his medical degree from the University of Santo Tomas Faculty of Medicine and Surgery in Manila. He completed his internal medicine training at Michael Reese Hospital in Chicago and his pulmonary and critical fellowship in St. Elizabeth Medical Center here in Boston. He has a special interest in interventional pulmonology, advanced asthma management, and pulmonary rehabilitation. He's currently working as an attending physician in the ICU of the UMass Health Alliance Hospital in Leominster, Massachusetts. Our second panelist is Dr. Christine Sethna. She is the Division Director of Pediatric Nephrology at Cohen Children's Medical Center. She's an Associate Professor at the Zucker School of Medicine at Hofstra Northwell in New York and in the Feinstein Institutes for Medical Research. She earned her Bachelor's of Arts at Tufts University, her Master's of Education from Harvard University, and her medical degree from SUNY Downstate School of Medicine. She completed her training in general pediatrics and pediatric nephrology at the Children's Hospital at Philadelphia. Dr. Sethna has been involved in several research studies on pediatric kidney diseases, and also she has been an integral staff physician of the Cohen's Children's efforts against COVID-19. Last but not the least, we have our infectious disease expert for tonight's discussion, Dr. Macatangay. Dr. Bernard Macatangay received his medical degree at the University of the Philippines. He completed his internal medicine residency at the Roger Williams Medical Center here in Providence and his fellowship in infectious diseases at the University of Pittsburgh. He is an NIH-funded scientist in the Division of Infectious Diseases, working on translational and clinical HIV inflammation and cure research. He also serves as the Associate Director of the Pittsburgh Immunology Specialty Lab of the AIDS Clinical Trials Group. Aside from research, he also has clinical responsibilities at the UPMC Presbyterian Montefiore University Hospital, serving as an infectious disease consultant.